Lessons hadn't been heeded, plans hadn't been updated, assumptions remained unchallenged, and Scotland was not as prepared as it could have been, was it, Ms Freeman, when COVID hit?
There were certainly areas where Scotland could have been better prepared in terms of the underlying structure and the delivery of all those recommendations. But Scotland, like other countries throughout the world, was dealing with a virus which was unknown and new. So in that sense, I don't believe there is a plan that would have been possible, that would have been able in and of itself to cope with COVID-19. What we had was an infrastructure, including our resilience infrastructure, which you've heard of, which was the architecture, if you like, that we could rest upon whilst we came to terms, often on a daily basis, with what the impact of COVID meant in terms of health and social care provision.
Would you finally accept then that not running out of PPE under your definition still meant that many frontline Scottish medical staff didn't have correct and sufficient PPE and caused, for example, 47% of Scottish nurses being asked to reuse single-use equipment?
Well, I'm in no position to gainsay what that survey says. What I can, and I wouldn't wish to do so, but what I can say is that where issues were raised either through the PPE helpline or directly with me or any of my colleagues, we acted in real time to resolve those. And what I know, given that every single day I received an update from NSS on each item of equipment, how much we had, what was on order, whether there were concerns about ordering coming in, and with another ministerial colleague, we invested to set up a domestic supply chain of PPE in those circumstances of high global competition. Then I know that we had enough PPE, but clearly we encountered issues around distribution, both to where it was needed, but also within those locations to the individuals who needed specific PPE.
Thank you, my lady. I've got no further questions.
Thank you very much indeed, Ms Mitchell.